Hello. Today I'm going to talk to you about one of the most useful tools that I found in my practice for treating any sort of pain or sports injury. It's called prolotherapy. Prolotherapy is one of the most useful things I find for ACL injuries, lower back pain, neck pain, shoulder pain, tendonitis, golfer's elbow, carpal tunnel syndrome. And I'm going to give you a little bit of a background of what prolotherapy is today and why do we use it. Prolotherapy is considered to be a ligament tendon reconstruction. And so one of the wonderful parts of prolotherapy is that it's not a treatment that you have to do continually on a chosen area for life. It's something you do a set course of treatment for a number of treatments, and then from there, the problem is often permanently better because the ligaments now are healed. Ligaments and tendons, they often get weak. Why is that? Well, there's a number of reasons, but generally speaking, most of the time we'll see people come in with an injury, and ever since they've had that injury, months ago or years ago, that area continually gets injured again and again and again whenever they play soccer or use that body part on a regular basis. An obvious example in soccer would be a ligament sprain in the ankle where they've rolled over on their ankle and it's just never been the same since. And then from there, every 6 to 7 months, they keep on re-rolling it and re-injuring it. And it gets worse with time. The other challenge with ligaments is that they are pretty richly innervated, so they can cause a lot of discomfort and pain. And so you will see people that come in where they have chronic aching or chronic pain in an area, and they've had scans, they've had MRIs, X-rays, various forms of physical exam, massage, you name it, and there's not really a clear picture of what is causing their pain. Usually they'll go to the doctor, and the doctor will say, well, there's nothing really wrong with you, or we can't really find the cause of your pain. But the problem here is that the ligaments and tendons actually are causing the pain. They're chronically aching and nagging. And so one of the common syndromes you'll notice with people with, say, lower back pain is the cocktail party syndrome, where they'll be standing up somewhere for probably about 20 minutes and their back will start aching, and then they have to shift around a bit and move around, and then they feel a little bit better when they do that. But eventually the aching comes back, often quite quickly, and then from there they go sit down for a while and they're okay. And then 10 minutes later, the aching starts to come back again. And so they keep on shifting back and forth. And that's a very common scenario you'll see with a ligament or tendon injury. It tends not to be a severe, sharp stabbing pain in many cases, but it's this chronic ache that tends to be quite annoying and that can keep you up at night. And often it is quite a bit worse at night. With prolotherapy, all we're doing is we're injecting dextrose and procaine and sometimes vitamins and other nutrients into a ligament or tendon to try and stimulate some localized inflammation, to try and get the body to start depositing some more collagen, to try and get this tendon or ligament nice and strong again. You can compare a damaged ligament to almost like an old frayed rope. It's thicker, but it's not as dense. And so what will happen is that when we do an injection of prolotherapy, especially after several treatments, what will happen is that tendon or ligament will start getting tighter and smaller, where it will be much more dense and stronger to help hold those tissues together. The interesting part about it too is that the ligament or tendon will start to shorten back to the original length. One of the challenges with injury with prolotherapy is that what will happen is people will get injured and they'll sort of permanently stretch their ligaments, almost like an overstretched elastic band. And then from there, the joint is starting to wobble in such a way that the biomechanics of the joint changes. This does set the stage for a lot of osteoarthritic degeneration that happens in people. Much osteoarthritis can be attributed to weak ligaments around a joint for many, many years. And over time, the biomechanics changes and it starts to wear off the cartilage. This happens a lot in knees, for example. And so prolotherapy done early enough can be very preventative for many forms of osteoarthritis later on in life. As I said before, tendons and ligaments are what we mostly work on. Ligaments connect bone to bone, tendons connect muscle to bone. Both of them greatly contribute to proper biomechanics and stability of a joint. As I said before, we use dextrose. There are other solutions that are used. In my practice, I tend to focus mostly on dextrose and procaine. The reason why is I find that it gives us a happy medium of an inflammatory burst in the area, but it tends not to be too crippling for most people. Some of the stronger solutions, some could argue, might be more effective per treatment in certain cases, but the amount of pain and discomfort that the patient goes through is sometimes quite a bit more. So I found for myself, in my own treatments and the treatment of my patients, dextrose tends to be the most useful. It gives me the best happy medium, and the safety risk profile is excellent with dextrose. Now, who's going to respond to prolotherapy? Everyone can respond to prolotherapy, at least to a degree. But of course, when somebody is extremely unhealthy, extremely toxic, extremely burnt out, they're not going to have the same wound repair as a person that is young, vibrant, and fit. This is one of the reasons why we use this in the context of an overall naturopathic practice. Working on a person's general health and making sure that they're well nourished can be very helpful for improving overall prolotherapy outcomes. We all know as physicians that collagen is formed by proper protein utilization, proper hormone balance, enough vitamin C in your system. So if a person's undergoing massive chronic stress and they're not sleeping all night, they tend to have a reduced wound healing capacity. So they're going to need many, many, many more treatments than someone that has all these ducks in a row before they start treatment. That being said, a person doesn't have to be in perfect health to benefit from prolotherapy. But we always want to consider that when we're doing the case history of a patient. Who's going to respond quicker than another? This is a list of some of the common things that can benefit from prolotherapy. Neck pain, all sorts of sports injuries, back pain, arthritis, sciatica, heel spurs. And there's a number of other things too, but generally we can't list them all here. Pretty much if you've had an injury and you've never been the same since, prolotherapy is likely worthwhile to get checked out for. So we've already talked about this here, how it works. Essentially, we're just creating some inflammation in the area. Really, we're trying to trick the body into thinking the injury just happened today, so the body starts healing. A lot of times ligaments and tendons don't get great circulation, so they don't have a really great wound repair mechanism, especially in us older guys. So what will happen is that if we do the injections, it stimulates that approach to essentially get that wound healing process finished, which it hasn't obviously if the ligament's not healed. How do people respond and how does this treatment go? Well, it depends on how severe the injury is. What I found is the more severe the injury is in a person, the more likely they're going to flare quite a bit for about 3 or 4 days after a treatment. If an injury is very minor, they may be a little bit sore for a day or so, not too bad, but that generally goes away. It almost feels like they had a really hard workout on the area and it's a little bit beaten up, but other than that, it's not too big of a deal. What I found is after about 3 or 4 treatments, the amount of pain that a person goes after the treatment or experiences after the treatment tends to diminish quite greatly. And that's because the tendons and ligaments are starting to heal and there's not as much work to do. Over time, if you have a true damage in the tendon or ligament, it'll take several treatments before you get some good results. If you have just some reflex issues or some minor irritation in the area, I often see some change after 1 treatment. With people that have some more severe damage, more long-term chronic damage, then I would expect it's going to take 4 or 5 treatments before they start to notice some change. And once again, also you have to consider the general health of the patient at the time. The great thing about prolotherapy is that when you do get results, they tend to be longer lasting. It's not like when we do manipulation where we adjust a joint, move the spinal segment back into place. A person can be walking out of the office and it can basically pop out again. Prolotherapy is a little different that way. Once the ligaments get strong, they're done. They're done healing. The only challenge I find with patients is when they start feeling better, they're not necessarily better yet. So they go back doing some of the things that re-injured them or injured them in the first place. And so they basically will go injure themselves again before they've completed the prolotherapy process. So what I would suggest to most people is that you really need to be feeling really good for a couple months before you start going into some previously re-aggravating exercises or activities. So this is just an overall summary of generally wound healing and how wound healing works. When we actually stimulate inflammation in the body, there's an acute phase of inflammation, which is the first week essentially. After that, we have a phase where there's a lot of collagen and glue basically being deposited in the area to try and heal the wound. But the most important thing to understand is that the remodeling phase can happen for up to 2 years. So when you look at remodeling is when your connective tissue is finally finished healing, is when it's finally at full strength. So after prolotherapy, your wound healing can continue for 1 year to 2 years after treatment. And so it's one of those things, this is a long-term therapy, but it's a curative therapy when you do it right. Now, one of the things, there are some reasons why prolotherapy doesn't work in some patients. Not enough treatments were done. The solution wasn't strong enough. The most common one is the points treated were not the source of the pain. So there have been many cases where I've seen patients come in, they've had prolotherapy before with some other practitioners. Some of the practitioners were maybe not that experienced or not that familiar with the anatomy and where to go. And for whatever reason, they weren't injecting the right spot. And so when we inject the right area, then the patient notices a pronounced change in the overall symptomology. So it is very important that you have an experienced prolotherapist, not a person that just got out of a course last week and has done it 3 times. They will still be able to benefit many people, but if it's not working at that point, you need to consider maybe the practitioner is not experienced enough at that point. And so I would highly suggest that you get a good prolotherapist, not somebody that dabbles in it and does it once every 3 months. That's definitely a real major reason why prolotherapy fails, especially in lower backs and in shoulders. The other thing is what patients are doing. Patients that are unhealthy or stressed out, or they have underlying nutritional deficiencies, they're not going to heal as well. And the other thing is many patients coming in pain, they're on anti-inflammatories. Those drugs are absolutely contraindicated with prolotherapy. There are cases where I've seen people on low doses that have still benefited, but if you're not benefiting, that's the first thing that's got to go if you're really wanting to benefit from that treatment, especially if it's in the context of something that's not medically necessary for you to be taking. Okay, that's all I have for today. I hope this gives you a little bit more of a background on what prolotherapy is. If you're curious about any more information, just give the office a call or contact me at my email address. Thank you. Take care.